Welcome back to another Bish Plays, and today we're on episode 20 of our Project Hospital series. First of all, as it's a bit of a milestone episode, I just want to say thank you again for everybody that's watching, that's taken it blows my mind that people want to take time out of like their busy day and busy lives just to sit and watch me play a silly video game. So I just want to say thank you again so much for everybody that's watching. It is really appreciated. I didn't think we'd be going up to episode 20, I'm not gonna lie, and I didn't think I would end up enjoying this as much as I have. So yeah, let me dive straight in. Enough of that mushy crap out the way with now. What do we need to do today? So been having a little bit of a think, and I've been playing around. Before I've hit the record button, I've been sort of sat here thinking, right, what do we actually need to do? So I did fix this, because if you remember in the last episode, we ended up adding internal medicine, so we've got this upstairs, but we were like locked off here because I originally had done this, was all sort of closed off, and we sort of had a sort of like a corner desk sort of system. So I've changed all that now, made it a little bit more compact and a bit more neat and tidy, and we now actually have a proper corridor that goes up to this area, rather than people have to sort of cut through the waiting room. So yeah, I quite like that. I think it's turned out all right. Nothing too crazy. We did have in the last episode, if I remember rightly, their name was Linda. A patient, it's Linda! She crashed and we didn't have ICU. And I've been saying for a couple episodes now, I really need ICU. And I know some of you might go, that's probably not the right thing to do next. But I've sort of, I don't know, I'm trying to sort of, I've been sitting here thinking what we can add and what we can do to improve. I'm aware that I'm probably going to need to have a ward for internal medicine. We'll see how that goes. I'm not in a rush to add that just yet. ICU I still think is the next step, because a lot of these tasks here, I know I said in the last episode, I need to, a lot of this stuff is sort of bottleneck now, and I can't do much. I need to enable, I need ICU. It needs to happen. There's a task there, it literally says enable ICU. And then there's other ones about unlocking an ambulance and to buy an ambulance. And I can't buy an ambulance until I unlock the ability to buy an ambulance. And I can't do that until I have ICU. Where to put ICU is another question. I was thinking down here, because I like the idea of having it by the ambulance bay. There was an awesome comment a couple episodes ago. I will just I'll stick it back on screen just so you guys can see, but it was a good idea to have it down here so we could it's easier for the ambulance to get to and from. However, me being me, I don't know why, I just want to make my life difficult. I think up here I think it makes sense to have it on the second floor. Looking downstairs, a lot of this stuff down here is very, I don't want to say it's very intrusive medicine, like it's not very life affecting. Obviously we've got a little ward down here for ER, and we've got the diagnostics sort of section in the centre, but there isn't anything really. So it's upstairs, we've got neurology, we've got the surgery, which is a shared room between all the departments, and I think it just makes sense. And we've had a lot more serious incidents happen upstairs with these departments than we have had downstairs. So my logic is we stick it up here. I could be completely wrong. Feel free to scream at me in the comments below if that is the wrong idea. I know it's going to make things really stupid, because people are going to be going like off the ambulance, down here, straight up through here, weaving around all this crap, getting in the elevator, waiting to go upstairs and in there. But how much do I really think we're going to get ambulance patients coming in? They're not going to be coming in every couple of minutes. Well, I don't know. They might be. As far as I'm aware, I think we'll probably only get 1 or 2 at a time, like a day during a shift. And I can deal with that. Just, 1 or 2 having to sort of run around the hospital a little bit to get to it. Because I think we're going to have more patients in the hospital that are going to already be in the hospital that are going to need it more. And I think that that's coming from upstairs. I could be completely wrong, and if it does turn out to be a terrible idea, I can move it. My only problem is, sorry, I will stop waffling on about where I'm going to put it in a second. Just kind of want to get my reasoning out there. I was thinking, how are they going to come down here? Now, I could have had a building here, sort of expanded out this way and had it down here. but then the only logical route to get to it is coming through labs, which is already a busy area of the hospital. I don't think people that are sat here waiting for their bloods to be done want to be seeing people in all sorts of conditions being sped through here. I know that's contradicting because you're gonna have all these people seeing it. I just think that it's almost just as a strange way of getting to it. I know that they're going to come off the ambulance and come up this way and we'll have an entrance for it, but I still think people in hospital is just gonna... Yeah, I just don't see that working, just having a little corridor here that sort of connects to this larger section that we're going to have. I could be completely wrong. So let me show you what my plan is so far. So if I go into ICU, I could have a separate ICU unit. I could just have one up here and then have a separate building down here, because I still want to keep this area back here free for when we unlock in the infectious diseases unit, which is something I'm really looking forward to doing, and that's something I'm quite excited about. I want some Ebola and I want some smallpox, so let's go a bit crazy. Plan up here. So I've turned the comms room into a makeshift janitor's closet for ICU. Now, I was thinking about putting it here, but I quite like this being open plan. We haven't really got any visitors room set up, and I don't think ICU has one. Yeah, because looking at the rooms and stuff, we don't have, but that's not an option to do. So I kind of want to make this a sort of like a makeshift sort of waiting area. Maybe I'll put a tiny little room here with like a sofa, or maybe I'll just put more chairs here and just have like a group seating area. This is obviously going to be open plan. The nurses station and the actual doctor's room will be closed off, so we'll have the nurses station open plan. I was thinking doing them here next to each other side by side, and we'll have the ward here. I'm not expanding out up here, I'm not making it terribly large, and the reason I've sort of put these two up here is to keep this walkway free a bit, so people can sort of come up and sort of swing around rather than having one room here, or and having a space here, because I was originally going to put the station here and do something similar I've done with this, but I think that that's just going to end up causing a bit more congestion. I know it probably doesn't really matter, but I think it just looks a bit tidier and neater. So yeah, that's my idea at the moment. Let me know down below how stupid it is on a scale of 1 to 10. But yeah, I think for the moment, just stick it up there. We need it. It's something that we need to have, because like I said, my main thing right now is getting some of these tasks done, and ICU is us not having it is literally bottlenecking what we can do. At the moment, I'm only going through the controlled doctor mode thing, and I know, but we can't just do that one task constantly on repeat. So I want to get some of these other ones done. So yeah, anyway, let's crack on. Let's get this built, and we'll see how it turns out. I don't know how expensive it's going to be. We've got 52 grand. If I need to let a day play out, we can do that, but obviously I'd rather not. So let's jump straight in. Thanks for that, listening to me waffle for over 8 minutes there. Right, let's get this done first, and then I'll sort out the rooms and what we need to do. So I've got... It's literally just, these are the main 3 rooms that we need. Okay, perfect. And I think we've got some doctors straggling around that don't have workstations, where I've moved things around. And I've hired people, or I think I've just got a spare doctor or 2, or maybe a nurse or 2 walking around. So I might not need to hire necessarily too many staff for this, but we'll see. Janitor's closets, let's get... Again, cheap and nasty. Sorry, I don't mean to call you nasty, Sarah. Nancy Miller. You're slow, you're coming in late, but you're also a hard worker. I'm going to go with you. Anyway, right, okay, that's my floor plan set up. So let's chuck the walls in. Again, it still bugs me that I've used the wrong wall type on the second layer, but it is what it is, beach. I'll do that. Inside here, we're just going to do the same as what we've got for neurology. I'll just do this. Yeah. Perfect. And in the actual... Is this the state? No, that's the... Yeah, this needs to be an actual room. And I don't believe we need as much staff as what we did for neurology. So I don't need to make these as massive as like I did with this one, where I had to actually do like a giant room with multiple workstations in. Floor wise, let's do... Yeah, we'll do this here like that. The actual ward we're gonna... Oh, no, that's the wrong button. Yeah, the actual ward we're gonna have white. And then... Doctor's room, I will do that different. I just like to sort of break it up a little bit, try and have the open planned areas and the corridors one colour, and then just having the actual individual rooms a bit different. I just think it makes it's a bit easier on like finding stuff. Let me just get this wall colour sorted out, because that will bug me. 1 and 2. Do I need to do it in here? No, that's done. Beautiful. Right, let's do this. This is gonna be cheap and easy. We're not going crazy, so I wanted this style. Oh, wrong button. I've been playing RimWorld and I've forgotten the controls for everything. As well as Planet Coaster. I'm playing all these games, all these like micromanagement sims, and they all have different navigation, like how you navigate around the camera and how you use it. So it's I've not juggled this many games since I was like a 15-year-old boy, like when I just couldn't stop playing like everything. And me being 34 now, my brain just cannot like remember all of the different ways of doing stuff. Let's do... Yeah, we're having green chairs up here, aren't we? Actually, no. Yeah, I'll match the desk. I was going to go for red, being ICU, make it look a bit more like alarming. We just need the one station up here for this one. That goes there. Oh, we have to have one of them desks. Am I in the wrong... Have I done this the wrong way around? No, this is right. Oh, it's yellow. It's not like, it doesn't say like it's 100% needed. That's fine. Right, I'm going to stick that there. We will put the wheelchair in back there. I love these little card files. They just give reception vibes. An empty shelf? Nah. Medical shelf. Beautiful. Right, this room. Let's get... I think I just need the one doctor in here. Right, I'm going to go for green. Where do I want you? Stick you up there in that corner. Nice comfy chair. PC. Printer. Now, I'm going to do what I did with the other sort of rooms, because these are on call. They're there quite, they're there quite a lot. So I'm just going to add some creature comforts in here. I'll go black. Do that, and then pop a little TV on there. There we go. What else did we want in here? Nothing too crazy. I think we'll get a little plant. Sit there in the corner. Then we just need a door and some windows. So I'll do one window. No, we'll do a double window like that. Have one behind the nurse's station. We just want a standard white door. Have that there in the centre. ICU, we'll just go with these normal doors that we've had before. I'm going to stick it about there. I want to sort of have it centre, because I want to sort of put chairs and stuff in this bit, this little section here. And right, ICU. Oh, this is going to get so expensive. I can already feel it. Oh, we can't even use the cheap, nasty beds that we've been doing in all the other wards. So we've got modern and we've got high tech, which are both exactly the same price. So let's go high tech. Screw it. Only the best. So we'll go 1. It needs, how many spaces does it need? Let me do 1 first before I do the rest of them. So what other bits of equipment do we need around the beds? We need a life monitor. We've got that one and that one. Screw it, we'll go for the nice one. We need a medical ventilator, which goes there. We need life support, which it's telling me to put here. Hang on, have I got that? Oh, no, that's a monitor. Oh. It seems a bit mad sticking it there. No, it's still saying it's missing. You just move this. Can I have that at the bottom of the bed? What even is that again? That's a medical ventilator. We can have that at the bottom of the bed. I don't know. Oh yeah, that needs to go there. Oh, that makes sense. Okay. Do we need anything else for this? No, that is set up now and ready to go. Let's get the other basics in the room, and then what we'll do is we'll do a little copy and paste jobby to move the beds around. So we need a mobile cabinet, so we're going to stick that by the door. We also need a defibrillator. That won't go on there, will it? Nope. I have one there. Disinfectant on the by the door. Defib. Can we have a wall defib? Yeah. Because I need a CRP scanner, don't I? Oh, you need quite a bit in here. Okay, let's get... do another one of them. Still need some more things. Mobile workstation there. No, not that one. I want that one. I'm trying to like save space. That won't go on there. What do you rest on? It seems weird putting it on like a table. Yeah, it just seems odd having it there like that. Oh, I can have that, but no, it doesn't work, does it? Nah, I have that by the door. Right, okay, I don't know how many beds we're going to be able to get in here, because that was like 20 grand, maybe more. Let's do this, prefab. We can do one there. It's going to add a wall, for God's sake. Oh no, I have no money. Uh-oh. I'm in the minus. That's fine. Is that enough to open that room though? That's fine, there's a stretcher here. And then we'll just have some windows. I can't afford windows. Oh shit. Uh-oh. Okay, well, I think we've got enough to open ICU now, haven't we? We just need this. I don't have... I thought I had staff I could have used. No, I don't. I'm going to have to hire. Okay, that's fine. What do we need? So we need one doctor. We need an anesthesiologist. Okay, is that literally it? I'm going to go with the expensive stuff, ICU. I feel like we should. You're a night owl, so Carol, I'll put you on the night shift. You're slow. That's not going to be good in ICU. If there's an emergency, then we're going to be screwed. I can't re-roll because I don't have the money. So, you do have receptionist 15 though, Mark. You're sometimes late though. You, however, patient care 9%. Ah, if I click that, it let me change it without casting as a re-roll. Let me do... Okay, you are clean feet. Long commute. Do I go for the risk with long commute? I just like these stats. I feel like we need the best of the best in this area. Right. What have we got here? Rachel, you're bloody expensive, but look at them stats. Fuck me, you're a tough old bird, aren't you? Look, 91 diagnosis, anesthesiology 31, intensive care 90. You're in. And for night shift, I was going to look at... I was going to go for the cheapest for night shift. But you got dirty feet. Although here, anesthesiology. You're also you're resistant, and you've got... and you're a diagnostics genius. Because I was looking at advanced diagnostics here on Sarah. However, that trait should hopefully balance out the fact he hasn't got that. So let's go with Richard. There we go. Hell yeah, beach. Objective complete at last. Now, I need a chief doctor in here. It's gotta be Rachel. It's gotta be... She's a boss bitch. It's gotta be Rachel. Everything here is up and running. First go. Perfect. No mistakes. That is really... what's the word I'm looking for here? Intimidating. Okay, we've got 4 ICU beds. I generally can't see this being busy. I can't do anything now until we have more money, and we're going to need to play a day out. So I think what we do is we're just going to quickly try and clear off these last 10 in resident mode. And then we should hopefully have some money. And we can look at purchasing an ambulance, because we need one of them. Need a Nenor. Right, let me go down here to doctor mode. Okay, so it's myself, Christopher, and Jane. Perfect. Let's start the day. Right, what's up with you? You need to be up in psychiatry. Although, wow, you're getting through it. Tobacco disorder. Okay, that's fine. I'm already on it, game. I'm already on it. Varenicline? Never heard of it. Can I not treat that here? The patient's waiting for you to plan another treatment. I'll send them home. I can't... Yeah, I can't treat that here. Okay, you need to go up to psychiatry then. Off your pop, Karen. Beautiful. Right, let's get these 10 done. Because we need money. Let me speed up a bit. Mark Miller. Swollen ear canal and diminished hearing. You're going to be internal medicine, aren't you? See if it's something we can treat. Physical exam. Ear examination. Okay. We'll see if that's something we can treat. Hopefully it is. If not, we'll pop them over to the IM. Come on, speed up. William! Just your annual checkup. You're going to be an all body thing, aren't you? Whole body examination. Yep, there you go. Michael, what's up with you? Okay, so it's going to be something sexual health. Groin examination. PCR testing. We can do them too. Let's do that. We'll do the groin exam. And where's PCR? I thought that was something we could do in ER. Just come on, get your keks down. Let's have a look at your bits first. Annual checkup. You're going to be... Oh no, we done? Oh, you're done. You can go home. Perfect. Michael. That didn't help, did it? Okay, we're just going to send you straight over to sexual health. We need to treat patients we can actually treat. Okay, is that something we can do here? Eardrops. No, it does need to be over in internal... It was internal medicine, wasn't it? Yep. Okay, off you go over to them. That's annoying. I was hoping that's something we could have done. Patient is leaving. What's wrong with you? Let's blue light you. So hopefully you get seen to... Oh, it's already says you're leaving. Patient can't be fully treated. You need a hydrocortisone, which hospitalization required for internal medicine. Oh, for God's sake. I'm getting ready for the comments to go. You should have used this area for hospitalization for like internal medicine. But it's fine. I'm planning on building this out, and I would quite like to have the ward for this area over here, because I like the idea of having the receptionists, sort of the reception for this area, the nurses station, etc, etc. I quite want to do it this way. So yeah, we will come to doing that, but it's going to be over here. I can already envision where I want that to be. Okay, that's fine. If we can't treat you, pop off to another hospital then. Okay, see you later. Alright, back downstairs. Nancy. Okay, so it's literally going to just be HIV, because we don't have these departments. Physical exam, oral cavity, PCR testing. Oh no, it wasn't PCR, we have CRP. I'm going to send you over to sexual health because that's not something we can deal with, I'm afraid. I'm pretty sure it's not. Rachel Martin. Although I'm now thinking about it, I think HIV, I think you need to have hospitalization for that. Which again I can do because I can expand the back of this out. But that's when we have money. Okay, what's up with you? It's literally just going to be asthma. Yeah, because we don't have ears, nose and throat, and we don't have cardiology, so it's that one. Okay, you get that. Off you go home. Dana, neurology. Is this something we can treat though? Because this should just be eye drops, shouldn't it? Physical exam, neurological testing, basic visual. Okay, let's do physical, neurological, basic visual, and we'll do that. You're getting the full treatment. Jane. Rash on torso. Okay. We'll do a physical, and what was the other thing? We've got a skin allergy test, haven't we? No, most of this is just physical. Okay, get a physical done. I can do skin allergy tests. Screw it, we're doing it anyway. Charles, what's up with you? Okay, we're going to focus on this. Interview we've done. Physical we can do. Yeah, let's do physical. Charles, still no luck. Should we do bloods? I think we go do bloods on this one. Where's blood draw? Blood smear sample. No, we don't want that. We want an actual blood draw. Yeah, go get your bloods done and come back to me. Jane, there we go. And then we can treat that with, is it antihistamines? No, it isn't. Quarter steroid cream. Yeah, have that. Off you pop. Dana. Okay, I think I'm gonna have to send you up to neurology, aren't I? Yeah, we didn't work. Okay, up to neurology. So we can get a cheeky one there from neurology. I'm 33 out of 40. Roberts. There we go. You need... Okay, give you them. Off you pop. Christopher. That is going to be antibiotics, which we don't have. That's sexual health, isn't it? Surely, as ER, we should be able to give out antibiotics. Ugh, it's ridiculous. Peter. Antibiotics. No, we can't. Again, sexual health. Employee leveled up. Go on, Babs. Now specialists. Well done, girl. Casey Lopez. It's going to be psychiatry, isn't it? Yep. Send you straight upstairs. Oh, we're getting so many, like, wrong department ones today. Come on, we only need 6 more. Rash. It's going to be internal medicine, isn't it? Or sexual health. I think we just do the basics on this one. Yeah, let's do the basic checks. So let's do... where was it? Physical. We'll do neck. Let's do oral. I wanted to do the skin, whatever the skin one is, which I can't see. Sampling test, which we don't have, and we'll just check the chest. Go on, let's do that. I'm sure that'll help. James, COVID vaccine, nice and easy. That's something we can do. Off you pop. I missed someone there. Who was that? Casey Taylor. Okay. Let's just get some of the basics done. We'll do physical, do speech. Neurological testing. The reason I've done speech is because I can see that there's quite a few things here for psychiatry, which seems to be a routine thing they do. So let's just see if that brings up anything. If not, I'll send them up to psychiatry. Fuck me. That didn't help at all, did it? Is it 2% everything? Yep. Let's do some more basics. Temperature, speech, check chest. Blood's come back with nothing. Let's do family medical history. And we'll just do an evaluation. See if that brings up anything. Carol. Right. It's not going to be infectious, anything infectious diseases. You were the one with the rash. You was. Got a headache as well. Let's do a groin exam in case it is something to do with sexual health. Let's do differential diagnosis and evaluation. We're getting so many that just don't fit into ER, and I don't know how to. It's like when you've got a list of like 40 on here, it's like what? How do you even whittle that down? Okay, so insomnia is going to be sleeping drugs. There we go. That's one more done. Right, we've got 5 to go. Go on, Dana, leveling up. GG's, girl. Carol. Okay, so could be syphilis, or it's chlorine gas poisoning. I'm gonna go with syphilis. Temperature, physical. Yeah, let's. We've done a physical. Let's do temperature. What else could we do for that? Done a groin examination. Serologic testing, which we can't do. Okay, if the temperature doesn't show it to be syphilis, then I'll send them up to internal medicine, maybe. Judy, what is up with you? The surgeons haven't found the expected symptoms during surgery. The patient was most likely misdiagnosed. A 20,000 penalty has been immediately applied by their insurance company. I didn't know that was a thing. Okay. Sorry. Okay. Fuck, we were just getting our money back. Oh, Carol. Ah, okay. So we know it's syphilis because we don't have these other departments. It got rid of the internal medicine option. Okay, so it is syphilis. Can I click it from here? No. So it's that. Is that something we can give you? Antibiotics, which we can't give out. All that wasted time. Go over to sexual health. Bronchitis. Let's do check. We'll do a temperature, chest, and all that. We've done chest. We've done temperature. What else on here was it in case it is bronchitis? X-ray. We can send them over to micro. Physical we've done. Do I go get the chest done? I'm just going to do a couple more oral stuff. I don't know, screw it. Go get your chest done. I don't care. Get out of my office. No, that didn't help. Okay. Come on, it's like 1 in the afternoon. We're running out of time, beach. One, actually, let's have a quick look. How is ICU? Have we got anyone in ICU? No, of course we haven't. I honestly don't think that's a department that's going to get used much at all. I'm probably completely wrong. Foreshadowing or whatever it's called. We've got no more patients. Okay, right. Didn't help. I might send you up to internal medicine. I don't know what else I can do to check. Do you know what? Screw it. Have everything done. I just want to try something. I want to exhaust every option I have in my arsenal. And I want to see what you come back with. If it's nothing, then what am I supposed to do? Right. Let's see what happens with him. Okay. Susan, bronchitis. That's something we can treat, isn't it? Antibiotics. Yep. Have them. Off you go home. Okay, you're back. Didn't help. Do you know what? I'm just sending you up to internal medicine. I don't care. Get out. Go be someone else's problem. Right, we need 3 more. Let's get night time. No one else to see us? Nope. Oh, here we go. Jessica. Okay, so... couple things it could be. Alright, let's just check our stuff first. Physical exam, physical, temperature. Okay, let's do a physical. There we go. Raymond syndrome, which is that. Off you go. Right, we need 2 more. I could take over the 2 night shift ER doctors. Just to get the last 2 done. Because we're going to need that grant now because that 20 grand penalty. Oh, here we go. Arm contusion. You're going to be numbing ointment, aren't you? Yep. Okay. 1 more to do. Come on, 1 more. Let's have 1 easy one. Come on, someone need a COVID jab or a annual checkup. Come on, we need 1 more, 1 more. No one's going to come in, are they? Nah. Go on, William. Our surgeon. Our in-house surgeon. And Dana. Let's go. A very talented hospital. Okay, that's them all done. I think so anyway, these 2 are sticking around. Oh, it's because they were told, oh my god, go on, have that, get out, go home. I've done it, you can go home now. Let's go! Increase clinic patients per day to 25. Oh, I thought we got a grant for that one. Okay, perfect. Right, let me pause and let me come out of this mode. Done treating patients. They can do it themselves now. Okay. None were critical. I was worried about radiology, but it wasn't showing critical. Perfect. Department can't diagnose a patient. Oh god, you're riddled. Sleeping problems, irritability and anxiety. That sounds like it's going to be psychiatry. So let's get you up there. And blue light you so you get seen quicker. Yeah, I didn't think no one was going to use this room. I was going to say, let's check our finances. We're minus 10 grand. Awesome. Obviously, we wouldn't have been. We would have been 10 grand up. What if you were to take that penalty off? That's not going to give an accurate reflection because we're a building. Yeah. Okay, cool. That's annoying. I was going to, before I wrapped up here, I was just going to tidy up this room and put our little bits down here. But that's probably going to be it for today. I will get that stuff done in the next episode. So, hope you enjoyed that. Let me know down below what you think about where I put ICU. I can imagine that's probably a good topic for debate. I still think I can move it, and I still think I can have one like a maybe a smaller one down here with the ambulance. Obviously we need to sort the money out because we're about to go bankrupt, so maybe we could have something down here. I did want one upstairs, just to, because it does seem that we have a lot more serious stuff happening up here. So yeah, anyway, let me know down below what you think. Any suggestions for what you want to see in the next one? Maybe we could do infectious disease. No, I'm joking. We're not doing the next episode. Too soon. But yeah, thank you for watching, everybody. I hope you enjoyed it. If you made it this far, please consider dropping a like. And if you're not already, hitting that sub button to stay up to date on new videos when they come out. I'm having an idea of what we do when we sort of finish this off. A lot of people voted, so thank you so much for voting. I'm probably leaning towards a series 2. There'll probably be a small break between maybe a week of no Project Hospital when I do wrap this up. But this is, like I said, it's going to be a good couple episodes before we wrap this up. And then I'm probably going to do a couple of little one-off specials, maybe a sexual health only or an infectious disease only episode or 2. So yeah, we'll see what happens there. But anyway, enjoy the rest of your day. Take care. I'll see you in the next one. Bye.